Are you aware that nearly 1/3 of the world's population is tuberculosis infected? Of this, every year about 8 million to 10 million people become TB patients. Out of these, 90% are from the developing countries. Each year, 2 million die worldwide, victims of TB. The world has lost more than 200 million lives since 1882 due to tuberculosis. The TB death rate increases day by day. About 10,000 TB patients are discovered annually, even in Sri Lanka. The tuberculosis bacterium was first discovered on the 24th of March 1882. This was by scientist Robert Koch. It was only then that the BCG vaccine took the center stage to quell tuberculosis. This vaccine can protect children against the deadly form of tuberculosis, also known as miliary TB, that spreads throughout the brain and the body in childhood. But this immunization is not effective against the form of TB that affects adults. Currently, several antibiotics are used to cure TB. Any one of us can contract TB, but the environment one lives in, the level of pollution of that environment, poverty, malnutrition, and such other factors increase the likelihood of a person being affected by TB. Those who associate patients with sputum containing mycobacteria and those who are already having chronic lung diseases are more vulnerable to TB. In Sri Lanka, TB has spread quite widely in association with heavily populated areas. Of these, such districts as Colombo, Gampaha, Kalutara and Kandy occupy a foremost place. Siripala works in a factory. He exerts himself physically from morning till evening. Some time ago, Siripala suffered a slight cough. In addition, he had a little temperature in the nights. Quite visibly, Siripala lost weight. He did not have much of an appetite for his food. I began to sweat in the night. I felt greatly exhausted even after a little bit of exertion. Continuing my job became a considerable problem to me. After some time, Siripala experienced a chest pain. The cough did not stop. Blood began to issue with phlegm. Unable to escape the persuasion of his wife, Sarojini, Siripala met a doctor at last. The doctor did not tell him directly what his ailment was. To diagnose the illness, the doctor directed Siripala to a laboratory for a test. The simplest method of diagnosing TB is the examination of a sample of the patient's sputum. It is easy to identify the TB-causing Mycobacterium tuberculosis through a microscope. This TB-causing bacteria has the potentiality to take tuberculosis to any part of the body. The affected condition brought about in the lungs by these bacteria entering the lungs is described as pulmonary TB. The form of tuberculosis brought about in any other part of the body is described as extrapulmonary TB. As a percentage, they are 80% in Sri Lanka. Siripala too was affected by pulmonary TB. The environment he lives in and his working environment make him more vulnerable to be affected by TB. Special reasons for a person being affected by TB in this kind of environment are the crowded atmosphere and the lack of unpolluted air to breathe. The atmosphere, especially of slums and the line dwellings, makes persons more vulnerable to TB, as in that context, people get addicted to cigarettes and intoxicating drinks. All members of a family live crowded together within a small space. and also as they do not receive unpolluted air or sunlight. In the line dwellings in the plantation sector, the space is strictly limited. These dwellings do not have even minimum facilities. They receive only a limited supply of air. Inside these dwellings, many members of the family live crowded together. Majority in the plantation sector are extremely poor. Poverty and malnutrition exist at a very high level in the plantation sector. These conditions are conducive to the spread of TB. The same crowding exists in the boarding rooms associated with the free trade zones. Many people living crowded in small rooms and the non-availability of pure air and sufficient sunlight cause the rapid spread of the disease-causing bacteria. TB is not hereditary. It is an infectious disease. Not only when a TB-affected person coughs or sneezes, but also when such a person laughs loudly or speaks aloud. The disease-causing bacterium enters into the air around, along with the droplets of phlegm released by the patient. The TB-causing agent can enter into the body of any person of any status. Even if the disease-causing agent enters the body, it will not appear as a disease. This state is described as the TB-infected state. If at any stage the immunity of the person were to get weakened, the concealed and suppressed TB will become active. Aged persons, those who suffer malnutrition, and also HIV-affected individuals, those with uncontrolled diabetes, those affected by cancer, and those with affected kidneys are more vulnerable to TB. Even if the bacterium is not present in the patient's phlegm, it is likely that the bacteria is present in that person's lungs. In addition, in any other organ of the body, TB can germinate, but the disease can be completely cured. Medicines have to be taken systematically in due time. To diagnose TB properly, 3 samples of sputum of the person with symptoms are tested. The first of those has to be submitted to the microscopic center of the patient's area instantly. The patient must visit the microscopic center, taking the second sample at his home the next morning. At the moment the second sample taken at home is handed over to the microscopic center, the third sample will also be taken. How the sputum sample is obtained is quite important. Immediately after one gets up in the morning, one should wash one's mouth well. After that, one should breathe deeply once or twice. Next, one should cough deeply, and the sputum produced that way should be added to the container provided by the health center. Close the lid tightly and hand the container over to the center. If the disease is diagnosed early at its early stage, and if the medicine is taken, the disease can be cured easily and also quickly. Besides, through early diagnosis, the harm done to the lungs and also to the person can be minimized. Swinitha is an attendant. She contracted TB while nursing patients. But today, Swinitha is in the best of health. Swinitha took steps to take medicine correctly and in due time. She has begun to resume her usual profession.
If the patient obtains proper medication, TB can be fully cured. I'm sure I escaped this disease because I took due medication methodically.
If you are having TB, it is quite important that you should cover your mouth and nose with a handkerchief when you cough and sneeze. Collect the saliva and phlegm in a container and either burn them or bury them. The TB patient should ensure that sunlight and pure air are properly let into your dwelling. Sunlight and pure air reduce the danger of TB by killing microbacteria. Some get alarmed when they hear that someone is TB affected. This is because they are of the view that TB is incurable. This is not a matter to be frightened of. Besides, it is not at all proper to separate a TB patient from society.
DOTS ප්‍රතිකාර ක්‍රමය යටතේ දැන් ඕනම කෙනෙකුට ක්ෂය රෝගය සඳහා
TB is a disease that can be fully cured. One particular method of therapy that has registered high results in curing and controlling the disease is DOTS, or Directly Observed Treatment Short Course. Using the DOTS strategy of treatment, all persons suspected of TB are tested free. The patient can be fully cured through the DOTS system. Under this system, at least for 2 months or 3 months, we observe every dose of medicine taken by the patient. This medicine must be taken for 6 months without an interruption. The patient's commitment is also quite important. Under the DOTS system, Directly Observed Treatment Short Course, the patient is kept under observation by a responsible person, could either be a Grama Sevika, a doctor, a health worker, a religious leader, a trained voluntary worker, or a community leader resident in the patient's area. In terms of the National Program for Tuberculosis Control and Chest Diseases Program, implemented island-wide, this responsible person is appointed by the chest clinic in the relevant area. The patient has the option to appoint someone he likes from his area. The prescribed dose should be taken 6 months. If the medicine is stopped midway, TB will become incurable. Some may develop minor side effects, itch, vomiting, eyes turning yellowish, sight defects. In such a context, the patient should meet his doctor urgently. Clinics are held island-wide to counter TB through district chest clinics, including the Valisara Chest Hospital. The National Program for Tuberculosis Control and Chest Diseases Program conducts health education programs to build awareness about TB.
විශේෂයෙන්ම ලෝක සෞඛ්‍ය සංවිධානය වැනි ආයතන අපිට
Institutions like the World Health Organization provide us technical cooperation. Such institutions as the Global Fund give us monetary assistance to launch these activities and to maintain international relations. They assist us to conduct TB control campaigns successfully. We are proud to say that in the context TB control, we are well ahead of most other countries in the Asian region.
මේ ආසියාතික කලාපෙත් ලෝකයේ බොහෝ රටවල් තින් ගත්තාම අපි ඉතාමත් ඉහළ තලයක ඉන්නවා ක්ෂය රෝග මර්ධන කටයුතු සම්බන්ධව.
Remember, TB is not only a health problem, it is a social problem as well. The spread or the prevention of TB is decided by the step you take. Maybe today your neighbor or your friend is TB affected, but tomorrow it could either be you or a member of your family. Given this situation, if you meet a person with TB symptoms, you must direct him to a doctor as quickly as possible for proper medication. That's not all. Through this, you can join DOTS therapy promotion and be a partner in the National Program for Tuberculosis Control and Chest Diseases campaign.